Welcome to OSBT Standard Procedure 240, Bloodborne Pathogens Program, Employee Education. Basis for this program. Management has established a bloodborne pathogen exposure control program consisting of the following elements: assignment of responsibilities, exposure determination, method of compliance, personal protective equipment, housekeeping, regulated waste and laundry, signs and labels, hepatitis B vaccination, post-exposures evaluation and follow-up, employee training, and record keeping. Management recognizes that employees are at risk of exposures to bloodborne pathogens and believe that exposure can be minimized or eliminated by using a combination of engineering and work practice controls, the use of personal protective equipment, medical surveillance, and by having exposed workers vaccinated against hepatitis B and employee safety training. Bloodborne Pathogen Program. One drop can kill you. Today we are going to discuss bloodborne pathogens. We will be learning what they are, their dangers, how they are transmitted, what is our exposure plan, and what you will need to do if you are potentially exposed. Microorganisms that cause diseases are generally referred to as pathogens. They are generally classified into four main groups. Viruses are extremely small infectious agents that are basically packages of genetic material. They can reproduce only within cells of a living host by taking over and forcing the host cells to reproduce the virus. Some examples of this illness they cause include AIDS caused by HIV, hepatitis B, and a variety of colds and flus. Bacteria are one-celled living organisms that do not require a living host cell to reproduce. E. coli and salmonella are a couple examples that cause intestinal diseases, like tuberculosis. Fungi. Fungi and molds are single or multi-celled organisms that live by decomposing and absorbing organic material which they grow. They can cause diseases such as athlete's foot, ringworm, and farmer's lungs, and also cause asthma and allergies. Parasites are single or multi-celled organisms that live upon or within other living hosts to which they obtain some nutritional advantage. Some examples include malaria and trichosis. Trichosis is caused by eating raw or undercooked pork and wild game products infected with the larva of the trichello worm. Bloodborne pathogens are also other potentially infectious material and can cause disease. Quickly take a look at this slide to see the way that it can cause these diseases. Hepatitis family. There are three most common types of viral hepatitis are A, B, and C. Signs and symptoms of hepatitis include enlargement of the liver, lymph nodes, and often the spleen, headaches, continuous fatigue, nausea, anorexia, abdominal pain, and sometimes a mild fever. Hepatitis B. Hepatitis B ranks the 9th killer in the world. The virus is found in blood and saliva and can lay dormant for several weeks before any symptoms develop. It is usually transmitted through contact with bodily fluids, broken skin, injection of infected blood, or by the use of a contaminated needle, lancets, or equipment. The virus may take up to 6 months to incubate, and people may become a symptomatic carrier. The virus is a leading cause of chronic liver disease and cirrhosis, and can survive in dried up blood for up to 1 week at room temperature. Hepatitis B is a virus that affects the liver. While initially causing inflammation of the liver, it can potentially lead to more serious conditions such as cirrhosis and liver cancer. A hepatitis B can survive in dried up blood up to 7 days, making it significant for housekeepers, janitors, custodial personnel, laundry personnel whose contact with dried blood may come outside of emergency or first aid situation. Its symptoms are similar to the mild flu, starting with a sense of fatigue and stomach pain. However, it may take up to 9 months before the symptoms become noticeable. Hepatitis B can be chronic and fatal. Even if it is diagnosed and you get help, there's a chance you won't recover. About 6 to 10% of adults cannot clear the virus from their livers and develop chronic HBV. This is, they become hepatitis B carriers for life. 25% of the carriers later develop cirrhosis, which is there is no known cure for chronic hepatitis B. One strain, fluent hepatitis, develops in 1 to 2% of cases, and even 85% fatal with most medical care. There is a vaccine for hepatitis B, which can minimize your chances of acquiring the disease, which we'll talk about later. Hepatitis C. Hepatitis C infects about 30,000 Americans annually. About 85% of those infected become carriers, and 70% develop chronic hepatitis, leading to cirrhosis, liver failure, and liver cancer. The main mode of transportation is through blood transfusion. Unlike hepatitis B, there's no effective vaccine to prevent the acquisition of hepatitis C. Like hepatitis B, hepatitis C is a virus that affects the liver. On average, 75% of patients with hepatitis C infection will later develop chronic hepatitis, cirrhosis, or liver cancer. Nearly 4 million Americans are infected with hepatitis C. Only 25% are diagnosed. Hepatitis C can be chronic and fatal and is responsible for 8,000 to 10,000 deaths annually. Unlike hepatitis B, there is no effective vaccine to prevent against the acquisition of hepatitis C. HIV and AIDS. HIV, or human immunodeficiency virus, is a casual agent for AIDS. Can be transmitted through needle sharing, needle stick, blood exposure, or by contact with infectious bodily fluids. Most people infected with HIV will experience flu-like illness in 2 to 6 weeks post-infection, with symptoms of fever, fatigue, and aches. If HIV is undetected and treated, most persons will develop symptoms of AIDS: weight loss, diarrhea, fevers, infections, cancers, in about 7 to 10 years. After the initial infection, it may take years before the person infected shows any signs of HIV. While treatment is improving, AIDS is still a fatal disease with no known cure. Types of exposure. There are two types of blood and bodily fluid exposure. Cutaneous exposure to the eyes, nose, or mouth as a result of splashes, sprays, or direct contact. Percutaneous, a break in the skin, a cut, a lesion, etc. Each exposure has different transmission routes and thus requires different prevention measures. We've seen that you can get HIV, hepatitis B, and hepatitis C with infectious material into the body, but how does this happen? On the slide, you can see some of the most common ways infectious material can get into your bloodstream. Sharp objects puncturing your skin is one way. In medical settings, there are a lot of needles. This is especially dangerous. But this can happen anywhere. For example, you can handle broken glass covered with someone else's blood in our cut. Even small cuts, acne, or sunburn blisters can provide routes for bloodborne pathogens to enter the body. So if you have a small cut on your finger or a blister on your arm, and you come into contact with someone else's blood, you can become infected with the disease. Your eyes, nose, mouth provide routes of entry. For example, if you rub your eyes or nose with contaminated gloves or clothing, maybe your sleeve, you've put yourself at risk. Transmission of BBPs. Risk of infection depends on several factors: the pathogen involved, the type of route of exposure, the amount of virus in the infected blood at the time of the exposure, the amount of infected blood involved in the exposure, whether post-exposure treatment was taken, and specific immune response of the individual. Losing this much blood won't kill you, receiving this much could. Transmission of diseases. Organisms can enter the body by inhalation, air, ingestion, contaminated food or water, or direct blood contact, bloodborne. Ingestion. The pathogen is ingested, usually through contaminated hand or food. For example, the food-borne outbreaks of hepatitis A, the virus is shed in the feces of an infected restaurant worker who does not wash his or her hands properly after going to the restroom. It then spreads the virus by handling or preparing uncooked foods or touching the food after it's cooked. Bloodborne contact. This is the focus of today's training. In the following slides, I will explain how bloodborne diseases are transmitted, which diseases are the primary concern, and their incidence and prevalence in the symptoms of this disease. Routes of exposure. Transmitted through infectious body fluids, intravenous drug use, occupational exposures, prenatal exposures, open cuts, nicks and skin abrasions, dermatitis and acne, tattoo and body piercings. Transmission of BBPs, occupational exposure, means reasonably anticipated skin, eyes, mucous membrane, or piercing of the skin contact with blood or other potential infectious material that may result from the performance of the employee's duties. Exposure incidents is the broken skin, mucous membrane, and sharp injuries, exposure to blood or other potential infectious material. At the workplace, occupational exposure means reasonably anticipated skin, eye, mucous membrane, or contact through piercing with the skin, such as needles, cuts, or abrasions. Contact with blood or other potential material that may result in while the employee is doing his or her duty. Reasonably anticipated contact means potential contact as well as contact with blood or other potential infectious materials. And exposure incidents that specific contact with blood or other potential infectious materials is capable of transmitting bloodborne diseases. HSSE Exposure Control Plan. HSSE will determine the following elements: determination to identify employees who are at risk of exposure, the method and controls we will use to protect you from exposure and bloodborne pathogens, training and hazard communication requirements, post-exposure evaluation to follow up procedures you experience if you expose an incident, record keeping including any documentation of any occupational exposure incidents, and hepatitis B vaccine. Exposure determination. Who is at risk? All employees are potentially occupationally exposed. Reducing your risk. Exposure controls. Universal precautions, equipment, work practices, personal protective equipment, housekeeping, laundry handling, hazard communication, labeling, regulated waste. The risk of occupational exposure to BBPs can be reduced by the prevented of these methods we will discuss further, following the universal precautions, using safer medical devices and equipment, follow proper and safe workplace policies, practice, and procedures, control the disposal of waste, use appropriate PPE when in contact with blood or other potentially infectious materials as expected, maintain a clean workplace, make sure all contaminated materials are properly sealed and labeled. Exposure controls. Universal precautions. Universal precautions is a method of infection control in which all human blood and certain body fluids are treated as known to be infected with bloodborne pathogens. Universal precautions are to be absorbed in all situations where blood exposure or potential infectious material is possible. This also means that certain engineering and work practices should always be utilized in situations where exposures may occur. The concept of having universal precautions is an infection control system that considers blood and other potentially infectious material from all persons as containing a bloodborne disease, whether or not the person has been identified with having a bloodborne disease. Therefore, you must handle such material using methods to prevent or reduce the risk of exposing yourself. Observe the following universal precautions in situations where there is potential contact with blood or other potentially infectious material. Exposure controls, engineering controls, eye wash stations, hand washing sinks, sharp containers, biohazard waste bags, pocket disposable mouth-to-mouth resuscitation devices designed to isolate emergency personnel from direct contact with fluids. Engineering controls and work practice controls work in tandem to prevent exposure. Not only do you have to follow the right procedures, you have to use the right equipment. Engineering controls are items designed to reduce your exposure by removing, eliminating, or isolating hazard. Some examples include spill kits, hand washing stations, eye washing aid stations, biohazard waste bags and boxes, or healthcare setting, reshelving devices, and needles and scalpels. Work practice controls work in hand with engineering controls. These specific practices and procedures you perform part of the job to help eliminate the threat of an exposure. We'll review the PPE emergency response situations, proper hand washing cleanup, laundry, and waste disposal. Exposure controls, safe work practice controls. Are steps, procedures, or ways in which a job and task can be done safely to minimize exposure to blood or other potentially infectious materials. Exposure controls, safe work practices. Don't eat, drink, smoke, apply cosmetics or lip balm, or handle contact lenses in any work area where there is possibility of exposure to blood or other potentially infectious materials. Do not place food or drink in the refrigerators, freezers, shelves, cabinets, or on countertops or bench tops of any work area. Safe work practices. Hand washing is one of the most important practices used to prevent the transmission of bloodborne pathogens. Hands or other exposed skin should be thoroughly washed as soon as possible following the exposure incident. Use soft soap, antibacterial soap if possible. If you are working in an area without access to such facilities, you may use an anesthetic cleanser in conjunction with a clean cloth or paper towels or anesthetic towelettes. Hands or other exposed skin should be washed as soon as possible after exposure to an incident. Use soft antibacterial soap if possible. Avoid harsh, abrasive soaps. These may open fragile scabs and other sores. Safe work practices. During cleanup of spills and broken glassware, sharps contaminated with blood or other potentially infectious material, do the following. Wear protective eyewear and mask if splashing is anticipated. Remove glass and other sharp material from the brush and dust, pan, forceps, thermostat, etc. Do not use your hands. Properly discard all material into the sharps and puncture-resistant biohazards waste container. Use paper absorbent towels to soak up the spilled materials. Broken glassware, which may be contaminated, must be picked up only by using mechanical means such as tongs, brush, dustpans, or forceps, never with bare hands or gloved hands. Safe work practices. Clean up spills and broken glassware sharps contain. Clean the area with 10% bleach or EPA registered disinfectant. Saturate the spill area with disinfectant, leave for 10 minutes or as specified by product manufacturer, or allow to air dry. Properly dispose the material, towels, and cleaning materials into proper waste containers. Personal protective equipment. You must wear all required PPE. When equipment, safer devices, and safe work practices do not eliminate exposure, this is the use of personal protective equipment, or PPE, is required. PPE is an appropriate that will not permit blood or other potentially infectious materials to pass through or reach through your clothes, skin, eyes, mouth, or other mucous membranes. Make sure you remove all PPE when you leave the work area. Remove contaminated PPE carefully as to avoid contact with contaminated PPE surfaces, and dispose of designated containers. Exposure controls, personal protective equipment, protective clothing, lab coat, gown, apron, surgical cap or hood, shoe cover or foot or boot, fully enclosed suit. Personal protective equipment, PPE clothing, remove as soon as feasible. Use protective clothing if blood or other infectious material penetrated. Eye, face protection, and mask. Safety glasses with side shields, splash goggles, face shield, mask. Wear appropriate face and eye protection when splashes, sprays, splatters, and droplets of blood or other potentially infectious material pose a hazard to the eye, nose, or mouth. Face shields should be needed if the risk of other potentially splash or splatter to the face is substantial. The skin as well as the eyes need to be protected. If the risk of splash is minimal, glasses with side shields might be adequate. Splash goggles or the use of a mask combination with eye protection device may be required in a higher risk situation. Safe handling and use of PPE. Remove all blood-penetrated garments and personal protective equipment following contamination and place in appropriately designed area or containers for storing, washing, decontaminating, or disregarding. Wear appropriate gloves when there is potential for hand contact with blood or other potential infectious materials, mucous membranes, non-intact skin, or when handling, touching contaminated items or surfaces. Replace gloves if torn, punctured, contaminated, or if their ability to function as a barrier is compromised. Housekeeping. Maintain a clean and sanitary workplace. Written cleaning and decontamination schedule and procedures. Approved disinfectant, bleach, EPA approved. Contaminated waste disposal methods, laundry. And all work areas are to be maintained and clean in a sanitary condition. Decontaminate all work surfaces with appropriate disinfectant at the end of each work shift. The appropriate disinfectant is an EPA-approved tubercular or HIV, hepatitis B effective disinfectant, or diluted bleach solution made daily. Laundry. List of contaminated articles. Handle as little as possible. Bag, containerize where used. Don't sort or rinse where used. Place in leak-proof, labeled, or color-coded container bags. Wear PPE when handling or sorting, gloves and gown. Contaminated laundry needs to be handled as little as possible and bagged and containered where it was used. Don't sort or rinse where the items were used. Containers or bags must be labeled with a red colored code. Wear the following PPE when handling and sorting laundry: gloves, gown, face shield, etc. Communication of hazards. Must have a biohazard symbol. Labels attached securely to any container or items containing blood or other potentially infectious material. Red bags containers may substitute for labels. Signs posted at the entrance of specific work areas. Containers containing blood or other potentious material or equipment containing with blood or other potentious material must have this orange to red label with a biohazard symbol. This must be labeled the following: regulated waste disposal, sharps container, container used to store, transport, or ship, example freezers, laundry, contaminated equipment, etc. The labels must be attached with a string wire adhesive and other methods so they don't become lost or accidentally removed. Red bags or red containers may be substitute for labels. We use red bags. Regulated waste. Liquid or semi-liquid blood or other potential infectious material. Contaminated items that would release blood or other potentially infectious material in the liquid or semi-liquid state of compressed. Items caked or dry with blood or other potentially infectious material able of releasing the materials during handling. Contaminated sharps. Pathological and microbiological waste containing blood or other potentially infectious material. Close immediately before removing or replacing. Place in second container if leaking possible or outside contamination if primary container occurs. If reusable, open, empty, and clean in a manner that will not expose you and other employees. Spill cleanup procedures. Only use disposable towels, gloves, and material to clean up blood because of difficulties laundering and disinfecting reusable items. If a spill involved broken glassware, never pick up the glass directly with your hands. Always use a mechanical means such as tongs or brush in a dustpan. Spill cleanup procedures. Isolate the area. Do not allow unauthorized persons to enter until the spill has been cleaned up. All surfaces to be cleaned must be first cleaned with a visible soil and blood before a disinfectant is applied. Carefully remove visible blood with disposable towels by putting them over a spill to absorb it. Soak with disinfectant until needed. Spill cleanup procedures. If a blood spill has dried, soak the area and scrub the area with disposable towels and disinfectant as needed. Place the towels in the plastic waste disposal bag that is either marked red or with a biohazard symbol. Spill cleanup procedures. After cleaning up a visible blood or soil, the area should be decontaminated a second time with the appropriate disinfectant used according to the manufacturer's directions. The area can have a final rinse after disinfection if needed. All cleanup materials including PPE, should be placed in a bag and double bagged. Laundry. Contaminated laundry shall be bagged or containered at a location where it was used, should not be sorted or rinsed where it was used. Contaminated laundry shall be placed and transported in bags or containers that are required for labeling requirements. Whenever contaminated laundry is wet and presents a reasonable likelihood for soak-through or leakage from the bag or container, shall be placed or transported in bags or container to prevent soak-through and or leakage. When contaminated laundry must be shipped off-site, must be labeled, color-coded, leak-proof, impervious bags. Regulated waste. Regulated waste must be placed in closable, leak-proof containers built to contain the contents during handling, storing, transporting, shipping, and labeled appropriately. Regulated waste includes liquid or semi-blood or other potentially infectious material, contaminated items that would release blood or potentially infectious material in the liquid or semi-liquid state, items that are caked with dried blood or potentially infectious material that are capable of releasing these materials during handling, pathological and microbiological waste containing blood or other potentially infectious material. Labeling. Containers of regulated waste, refrigerators and freezers containing blood and other potentially infectious material, and other containers to store, transport, or ship blood or potentially infectious material must be labeled with fluorescent orange or orange-red biohazard warning labels. The warning label must contain the biohazard symbol and have the word biohazard on it, and be attached in such a method to prevent loss or unintentional removal of the label. Exemptions. Red bags or containers are used, and individual containers already contain biohazard labels. Individual containers of biohazards are placed in a labeled container during storage, transport, shipment, or disposal. Hepatitis B vaccine is no cost to you. 3 shots, 0, 1 month, and 6 months. It's effective for 95% of adults. Post-vaccination testing for high-risk HCW. Post-exposure treatment if not vaccinated. Immunoglobulin. Begin vaccination series. If you decline, you must sign a declination letter. Vaccine available for later date if you decide. Hepatitis B vaccination. You do not require vaccination if you have previously received a complete vaccination of the series. Antibody testing reveals that you are immune. Medical reasons prevent you from being vaccinated. Employees who decline vaccination must sign a declination form indicating that they were offered the vaccination but refused. Vaccinations will be provided even if you initially decline but later decide to accept the vaccination. Healthcare professional requirements. Must be knowledgeable of bloodborne pathogens. Must review with employees the signs and symptoms of exposure. Must discuss vaccinations and their effectiveness. Must provide a written statement on whether there is a need for a hepatitis B vaccination or whether the employee has received it. What if an exposure incident occurs? Thoroughly clean the affected area. Wash needle sticks, cuts, and skins with soap and water. Flush the water splashes in nose and mouth. Irrigate eyes with clean water, saline, or sterile integrates. Report exposure to supervisor, person, or department responsible for managing exposures. Fill out the incident report form. In the incident report form, try to describe the exposure event as much in detail as possible. Submit it to your supervisor or the safety team. This allows you timely medical evaluations for follow-up healthcare professional, as well as timely tests for individuals' blood for HIV or hepatitis B. Post-exposure evaluation. Provide immediate post-exposure medical evaluation and follow-up to an employee exposed at no cost, confidential, testing for hepatitis B, hepatitis C, or HIV, or preventative treatment when indicated. Test the blood source of a person if hepatitis B, hepatitis C, or HIV status is unknown. If possible, proceed to result the exposed employee if possible. Medical evaluation must be provided as soon as possible. Even though there is no clear recommendation as low as to get the HIV post-exposure prophylaxis, the PEP, must be given to be effective. Most healthcare professionals recommend the HIV PEP to be given within hours after the exposure. There is no evidence that the HIV PEP is effective if given longer than 24 hours after exposure. HBV immune globulin may be given 7 days after the exposure, but most is effective if it's given as soon as possible after the exposure. There's no post-exposure preventative medicine for hepatitis C. Exposure key element steps. Direct source individual to an emergency center. Provide the treating healthcare provider with an incident report documenting routes of exposure and how exposure occurred. Identify and document the source of the individual pending consent. Obtain consent and test source individual blood tests as soon as possible to document the source's blood test results. We will provide your healthcare professional with a copy of Bloodborne Professional Standard, a description of your job duties as they relate to the incident, a report for the specific exposure incident report, including route of exposure and relevant employee medical records, including hepatitis B vaccination status. Exposure key element steps. The source is known to be infectious for hepatitis B or HIV. Testing does not need to be repeated. Provide the exposed employee with the test results and inform the applicant about disclosure laws and regulations concerning the source and identity of the infectious status. If an employee consents to base bloodline collection but not to HIV testing, the blood sample will be preserved for at least 90 days. If within 90 days of the exposure incident, the employee agrees to be sampled for HIV, the test should be conducted as soon as feasible. Follow exposure within 15 days. The healthcare professional is to provide employer with a statement that the employee has been informed the test results have been told for any further evaluation or treatment if needed. Provide exposed employee with a copy of evaluating healthcare professionals HCP written opinion within 15 days of completion of evaluation. Provide employee with information about laws on confidentiality for the source of individual. Provide post-exposure treatment as well as needed counseling. Record keeping, medical records. Confidential hepatitis B vaccine and post-exposure evaluations, HCP's written options, information provided to HCP as required, maintain length of employment, 30 plus years. Medical records maintained by OSBT do not contain any confidential medical information except for the hepatitis B vaccination status and the declination form. If you choose to waive being vaccinated, the HCP's written options or genetic information. They may contain medical diagnosis or disease resulting, and these are confidential in your medical information. Sharp's injury log. We keep separate Sharp's injury log. We also document Sharp's injury log on OSHA 300. The log includes the following information: type and brand of the device involved, department or work area where exposure occurred, an explanation of how the incident occurred. Training records, dates, content summary, trainer name and qualifications, attendee's name and job titles, maintained for 3 years. What is wrong or right? In this scene, a worker has suffered from a serious cut. A second worker who is trained in first aid has responded by applying pressure to the wound to stop the bleeding. What do you think is meant by the term bloodborne pathogens? What kind of diseases do you think bloodborne pathogens refer to? How do you think bloodborne pathogens are transferred? Is the worker trained in first aid adequately protecting himself from potential bloodborne hazards? Should the worker be wearing some type of gloves? Should the worker be wearing eye or face protection? Should the worker be kneeling in the blood? Arrow 1. The bloodborne pathogens can be transferred through damaged skin. Notice that the hands of the person administering first aid are exposed to blood. If the person's hands have any cuts, sores, chafed skin, or otherwise damaged skin, there's a potential for bloodborne pathogens inside the injured person to be transferred to the person administering first aid. When administering first aid on anyone, assume they carry an infected blood and wear protective gloves. Arrow 2. In the event of a deep cut or wound, blood could potentially splash across the face of the person administering aid. The eyes and mouth are easy ways for bloodborne pathogens to be contracted. If administering first aid with a person with a wound that's splurting blood, be sure to wear eye or face protection to keep the blood from getting in your eyes or mouth. And Arrow 3. Notice that the person administering first aid has knelt in blood, therefore it's providing another way for bloodborne pathogens to enter the skin. Any cuts, sores, or otherwise damaged skin will allow the bloodborne pathogens to enter. Corrected scenario. In this scenario, the victim's doing well enough to help her administer her own first aid. This allows the field administrator to avoid contact with the victim's blood. The best way to prevent contraction of bloodborne pathogens is to assume that all blood or other potentially infectious body fluids are contaminated and to avoid with those fluids. Therefore, when possible, have a victim put his or her bandages on or apply the pressure. Notice the person administering first aid is wearing latex gloves and safety glasses in case the victim needs help with the wound. By allowing the victim to apply pressure, the first aid administrator has not come in contact with any blood. The person's hands, face, or knees are not contaminated. What's wrong or right? In this scene, a worker has just finished doing her first aid on an injured coworker. She immediately cleaned up and disinfected the area contaminated by the worker's blood. The worker decided to get a snack from the vending machine. Is this the best place to remove the contaminated PPE gloves? Should contaminated gloves be thrown in the garbage? It looks like the worker's shirt is contaminated. What should the worker do with it? Should the worker do anything before eating the food out of the vending machine? Is there anything strange about her biohazard bag? Is there anything wrong with her hair or shoes? Now take the time to look at this and see if you can figure out what's wrong or right with this situation. What's wrong or right? In this scene, a worker is in the process of cleaning up blood following a severe injury of a coworker. Is this worker adequately protecting himself? Should the worker be wearing eye or face protection? Are paper towels a good way to soak up the blood? Are wet paper towels being thrown into an appropriate container for disposal? Are the tools being cleaned off appropriately? Is the area being disinfected? Arrow 1. The worker should be wearing some kind of eye or face protection. Although no longer exposed to splurting blood of a victim, the worker is using paper towels that, when wet, could splash blood onto his own eyes when he's cleaning the area or tossing it into the container. The worker's torn jeans allow blood to come into contact with his knee. A contaminated scrape or cut the knee. The same problems could arise when the worker is working with open-toe shoes. The worker is smart enough to wear latex gloves, although more precautions could be taken to prevent contamination. Instead of using his hands to mop up the mess, the worker could use towels to soak up the fluid, and then tools such as a dustpan or a piece of cardboard to scoop up the wet towels and put them in the container. The best method of decontamination is to prevent contamination in the first place. The extra precaution helps protect the worker against exposure of the gloves during use. This is not the right way to kind of container for handling the fluids. It must be closable and constructed of materials that will prevent fluid from leaks. Obviously, a thin, previously used plastic bag would become torn and allow the blood to leak. Instead, use a new plastic bag that has the universal biohazard symbol. Lastly, Arrow 6. The tools that are being used to wipe down the paper towels remove. However, they are not being decontaminated. There will still be residual dried blood on the tools. HIV will almost die immediately when it's exposed to air. However, Hepatitis B and hepatitis C can live up to 2 weeks in dried blood. These tools can cause someone to become exposed to bloodborne pathogens unless the tools are properly decontaminated. Do you have any questions? This concludes Bloodborne Pathogens training. In order to take the quiz, please copy-paste the hyperlink into your browser and begin.